During pregnancy, the health of the baby is a constant concern for all expectant mothers. While a woman's body undergoes many changes, it's important to be aware of signs that something might not be going well. In some cases, the baby could be in distress, and the body may send subtle or more obvious signals that something is wrong. In this video, we'll discuss 7 warning signs that indicate your baby might be in distress during pregnancy. Recognizing these signs early is crucial to ensure quick and effective medical intervention, protecting your baby's health. If you're pregnant or know someone who is, keep watching to learn how to recognize these signs and when to seek medical help. One of the most important signs to assess the baby's health during pregnancy is fetal movement. Typically, by the 16th week of pregnancy, mothers begin to feel the baby's first movements. When the baby starts moving less or stops moving entirely, it can be a sign that the baby is in distress. Decreased fetal movement can be caused by various factors such as lack of oxygen or issues with the placenta. If you notice that the baby is moving much less than usual or you don't feel any movements for a long period, it's crucial to seek medical attention immediately. Monitoring the baby's movements is one of the most effective ways to ensure the baby's health during pregnancy. Vaginal bleeding during pregnancy can be a sign of fetal distress and may indicate serious complications. While light spotting may occur early in pregnancy, more intense or persistent bleeding should be taken seriously. It can be a sign of placenta previa, placental abruption, or even miscarriage. When bleeding is accompanied by abdominal pain or severe cramping, it could indicate an issue with the placenta, which would compromise the supply of oxygen and nutrients to the baby. If you are pregnant and notice any bleeding, it is essential to seek medical attention immediately for proper evaluation. Intense abdominal pain can be a sign that something is wrong with the pregnancy, especially if it's accompanied by other symptoms like bleeding or fever. If you experience sharp pain in the lower abdomen, it could indicate issues like placental abruption or even uterine rupture. Placental abruption occurs when the placenta separates from the uterine wall prematurely, which can disrupt blood flow and affect the baby's health. Uterine rupture is a rare but serious complication where the uterus tears, requiring immediate medical intervention. If you experience intense and persistent pain, it's crucial to seek medical help immediately. Loss of amniotic fluid before the due time is a clear sign that something may be wrong with the pregnancy. When the amniotic sac ruptures prematurely, it can pose a risk to the baby as they become vulnerable to infections. Amniotic fluid loss can occur gradually, leaking, or suddenly, complete rupture of the sac. If you notice that you're losing fluid, it's crucial to seek medical attention immediately, as this can be a sign of complications such as infection or premature labor. The doctor will be able to monitor the situation and take necessary actions to protect both the baby's and mother's health. The fetal heart rate is an important indicator of the baby's health during pregnancy. The baby's heart typically beats between 110 and 160 beats per minute during a normal pregnancy. Significant changes in this rate, either too high or too low, can indicate that the baby is in distress. A very low heart rate can be a sign of fetal hypoxia, lack of oxygen, while a very high heart rate may indicate issues such as infection or maternal fever. If, during an ultrasound or monitoring, you notice that the baby's heart rate is outside of the normal range, it's important to consult a doctor immediately to ensure the baby's safety. While some swelling is normal during pregnancy, excessive and sudden swelling in the hands, feet, or face can be a sign of preeclampsia, a serious condition that affects the mother's blood pressure and can compromise the baby's health. Preeclampsia is characterized by high blood pressure and the presence of protein in the urine. This type of swelling, especially when accompanied by symptoms like severe headache, blurry vision, or stomach pain, may indicate that the mother is at risk. If you experience sudden swelling, it's important to seek medical help to evaluate blood pressure and undergo the necessary tests. While nausea and vomiting are common in early pregnancy, persistent vomiting and loss of appetite can be signs of a more serious complication, such as dehydration or even fetal hypoxia, lack of oxygen. When the mother's body is unable to eat or stay hydrated properly, it can directly affect the baby, as the baby relies on the nutrition the mother ingests. If vomiting is severe and lasts more than 1 or 2 days, or if you have trouble keeping liquids down, it's essential to seek medical help immediately. In some cases, dehydration can be severe, and the doctor may need to administer intravenous fluids or take other steps to ensure that both the mother and baby are getting the proper nutrition and hydration. Being aware of signs of fetal distress is crucial to ensuring the baby's health during pregnancy. As we've seen, the 7 warning signs include reduced fetal movement, vaginal bleeding, intense abdominal pain, loss of amniotic fluid, abnormal fetal heart rate, excessive and sudden swelling, and persistent vomiting with loss of appetite. Identifying these signs early and seeking medical help can make all the difference for the mother and baby's health. Whenever you notice any of these symptoms, don't hesitate to seek immediate medical attention. Early detection and proper monitoring are key to preventing serious complications. Remember, this is an educational video and should never replace a visit to a doctor or healthcare professional. If you found this video helpful, don't forget to subscribe to the channel, and leave a comment below. We'd love to hear your thoughts. If you know someone who is pregnant or are concerned about the baby's health, share this video so more moms can learn about the signs of fetal distress and how to act quickly.